like to introduce Stuart Smith, Board of Directors, Chair of the Foundation for Recovery, who without him, tonight would not be possible. Stuart's dedication and support of recovery is unprecedented. Please welcome Stuart Smith.
My name is Stuart Smith, and I'm a person in long-term recovery. And for me, what that means is that I haven't used any drugs, including alcohol, since 1983. What that's allowed me to do is reconnect with my family, my community. Really, tonight, what we're here about is to recognize some of the real heroes in our community that are doing something. We spend a lot of time focused on the things that aren't right, and it's important to every once in a while have an attaboy and recognize some people that are doing good in the community.
My name is John Shannon. Also, that ain't a lie. It's one of the first things I'm going to tell the truth on tonight. I am a person in long-term recovery. I thought I was a terrible human being destined to die in active addiction. I had no idea I had an illness that was treatable. And if you want to live a fruitful life free of active addiction, get involved with active recovery. You know, we have people that need help. We have systems that work. We have a lot of money out there, but it ain't matching up. You guys are the authentic recovery community. I know who a lot of you are. I know you're authentic. I know what you're doing. When we come together, work together, we are the solution addiction has on our communities. We are it. Okay? Yeah, you can applaud that. Now, I'm telling you people, I ain't asking you, I ain't being nice, I'm telling you. There's 23 million Americans out there that need recovery. And there's 23 million Americans in recovery. Can't we all just run down there and it's just one each? Pick that one up? We can solve these problems in America in no time. And you're in the room, you're a person of influence, an organization of influence, you stand together.
I moved to Las Vegas 20 years ago. I've been in the recovery, in the business side of recovery. I don't even know any political way to put that other than that, but I've been there for 12 years now and had Oxford houses in Las Vegas. I have 3 of them currently, and I've had them for over 10 years now. So they're my passion. They're what I want to do here. They're the people that I want to help in the population, and that's people with substance abuse issues.
I will tell you the first time I really understood what recovery was when I went to your gala last year. And I saw the people come up and speak. People that are in leadership came up and were celebrating. And I understand now. It's almost like having a birthday every day, because you have a new day to celebrate that you have your life back. And maybe I don't know what that's like, but I definitely know what it means to struggle and move through and get through things. So I share that with you. I celebrate you all.
And as John just reminded me, don't leave before the miracle happens. For me, the miracle happened. It didn't happen right away, but I kept coming back. As the end of meetings, I hear so much, keep coming back, it works. And for me, it worked. So thank you very much.
We know what the roadmap is to recovery. We know how to end this crisis. We just need them to start listening to us. And you know who I am talking about when I talk about them. We have to work for good, sensible policy, laws that protect us, affordable recovery access, criminal justice reform, and peer recovery supports. We need to ensure that decisions about our community are no longer made without us, period. We need to back elected officials who are clearly on our side, and we need to call out those who work against us.
The thing I learned about recovery, and the thing that's the most important to me, is this. There's a way out of this. And I work on the streets. That's what I do. I'm on the streets every day dealing with homeless individuals, and a majority of the homeless individuals that I deal with have substance abuse problems. There's a whole room full of miracles here right now, and there's a whole room full of people that Providence has shined upon. We have to be the change in this community. We have to. And what if we just operated under the principle of there are no rules and nothing can stop us? We already overcame death itself. I'd like to just hope that I really inspired you guys, because we're under attack. But miracles can happen. And if you don't believe that miracles can happen, then let me tell you this. Hi, my name is Louis Lacey, and I'm a miracle.
Number one, I didn't know anything about addiction as an emergency physician, that I always looked at addiction through that lens of an emergency physician, seeing that patient come through our emergency department, and I thought I was doing a good job if we reversed that overdose and saved their life. And we used to think that we were doing a good job by just reversing that overdose. No, we have so much more to do. We have an opportunity to grab that person off that cliff and connect them with all of you in this recovery, get them into long-term recovery, and that's an opportunity and a commitment for myself, for the House of Medicine, that we need to work on. And then the last thing is that we have to change the way we view people who overdose. We have to, and that's where you come in. You as a recovery community really help advocate and humanize addiction and humanize those individuals. They're not just patients that overdosed. They have loved ones. They make a difference in our community.
I've worked with Heidi and Chelsea, and they've championed everything when it comes to recovery, but one of the things that they've also helped to champion in the community is harm reduction. Harm reduction is the model that we use at Track B Exchange, and what we do is we work to reduce the risk of negative outcomes among people that are still engaging in risky behaviors, specifically needle use. And I think one of the most important things that we're able to do at Track B is that out of the approximately 60 people that we see per day at our syringe exchange, around one person a day comes in and they're asking us about treatment and recovery.
You know, in the future, I see homelessness eradicated through substance abuse treatment, education training, as well as affordable housing. As a survivor of both addiction and cancer myself, I can say firsthand that there is a stark contrast between the level of care that the two are given. I see a future where addiction is treated with the same fervor and dedication and compassion as cancer. In the future, I see a world where the stigmas that are attached to addiction no longer exist, and patients are free to ask for help without the fear of rejection and judgment attached to this disease. That we as professionals in the field can help those who may not know or recognize that addiction is in fact a disease, and that those affected are not merely weak or lack willpower, that those affected are indeed sick and need intensive and immediate treatment.
You know, I'm not the only parent who's had issues with their kids. I'm not the only parent, when the phone rings, that you really wonder what's going to happen next. You know, not the only parent that worries that their kid is going to die before they may get the chance to recover. And it wasn't my own recovery that brought me to advocacy, it was my kids. All I know is that as a parent with children with issues, I need to learn how to take care of myself too. And that's something that I think gets pushed aside a lot because they need so much. It's so wonderful when I come to these events and I get to see all of the good work that's being done. Even though more needs to be done, people are still there and trying.
Of all the ideas we have shared with you tonight, the most fundamental is that people can and do recover from addiction. That recovery process is life-affirming, not just for those of us who have experienced addiction, but for our families, friends, neighbors, and coworkers. Truly appreciate your support. Thank you and good night.